Something strange is happening in southern China. People are being hospitalized not with COVID, but something else. Hospitals are netting off patients. Drones are filling the skies with white clouds, and authorities are acting fast, too fast, like they've seen this before. This isn't a science fiction story. This is chikungunya, and what's happening right now in Guangdong may just be the opening chapter of something much bigger. Because this virus isn't just spreading, it's spreading in silence. And while media headlines are calling it mild, thousands are suffering, locked behind nets, while a new generation of genetically modified mosquitoes is being released to fight back. Today on World Alert, we're asking, what exactly is this virus? Why now? Why China? And what are you not being told? Let's break it down. Part 1. What is chikungunya? Chikungunya, the name comes from an African word meaning to become contorted, describing the twisted posture of those in pain. It's a virus carried by mosquitoes, mainly the Aedes aegypti and Aedes albopictus species, the same mosquitoes that spread dengue and Zika. Once bitten, symptoms typically begin within 4 to 8 days. Sudden high fever, intense joint pain, often disabling, rash, muscle aches, headaches, and fatigue that can linger for weeks. But here's the catch. Even when the fever fades, the pain can persist. For some, it lasts months. For others, years. There's no specific treatment, no antiviral cure, only rest, hydration, and anti-inflammatories. And unlike COVID, there's no clear public infrastructure prepared to track its long-term effects. Part 2. China's growing crisis. The epicenter of the current outbreak is Foshan, a city in Guangdong province. In just 4 weeks, China has reported over 8,000 cases, and some experts believe the number is far higher. Hospitals have begun using mosquito nets to isolate patients. Entire wards now resemble post-apocalyptic quarantine zones. Outside, drones sweep the skies, spraying massive white plumes of insecticide across neighborhoods. And it's not just chemicals. China has deployed elephant mosquitoes, lab-modified insects designed to kill mosquito larvae. The visuals are striking. Cities shrouded in white mist, teams in hazmat, footage eerily similar to early COVID lockdowns. But here's the twist. Chikungunya doesn't spread human to human. So why the panic? Why the hospitalizations? Why the overreaction? That's the question no one's answering. Part 3. How the virus is spreading globally. While China is scrambling, this isn't a local outbreak anymore. The virus is now being detected in Taiwan, Hong Kong, India, Reunion Island, and parts of Europe, including France and Italy. The World Health Organization has issued an urgent alert. 5.6 billion people now live in mosquito-friendly regions. And due to climate change, these zones are expanding. Warmer temperatures, heavier monsoons, standing water, urban sprawl, all of these are creating the perfect conditions for this virus to go global. In the United States, the CDC just issued a Level 2 travel advisory, urging enhanced precautions for anyone traveling to China or Southeast Asia. This is a virus without borders, and it's riding the wings of a mosquito. Part 4. What you are not being told. Now here's where it gets serious. Behind the scenes, some virologists are warning, chikungunya may be mutating. A new study suggests the virus may now infect cartilage cells, potentially causing permanent joint damage. This could turn a week-long virus into a life-altering disease. And while China claims it's controlling the outbreak, social media tells a different story. Videos of thick white smoke rolling through city streets, children coughing, pets hiding, no clear disclosure of what's being sprayed. Doctors are not allowed to speak openly. Reporters are restricted. Even the term outbreak is being sanitized in official releases. And there's more. In late July, China's virus queen, Xi Zhengli, known for her controversial coronavirus research, was spotted in a rare government briefing on mosquito-borne pathogens. Why bring in a top-level virologist? Unless there's something far more serious happening behind closed doors. Part 5. What this means for you. You might be thinking, this is just another virus far away. Why should I care? Here's why. Because chikungunya doesn't care about borders. Mosquitoes are now thriving in cities like Houston, Rome, Tokyo, and Buenos Aires, places that were once too cold or dry. And global travel makes containment impossible. All it takes is one mosquito in one suitcase, and the virus starts over, somewhere new. Even if you're not infected, supply chains can be. Entire cities shutting down, factory workers being quarantined, shipments delayed, just like 2020, only quieter for now. So how do you protect yourself? Use insect repellent with DEET or picaridin. Wear long sleeves and pants, especially near water. Eliminate standing water around your home. Travel smart, especially to China, India, or East Africa. And stay informed, not just through headlines, but the deeper patterns beneath them. Part 6. Is this the next pandemic? Let's be clear. Chikungunya is not COVID. It won't shut down flights or close your borders tomorrow. But it is something else. It's a quiet test, a global stress test on our health systems, on our leadership, on our trust in information. And in the shadows of wars, wildfires, and floods, a tiny mosquito is reminding us we are not ready. The question is, will we listen this time? The world isn't getting safer. Join us and be the first to know what they won't tell you.